Hello guys, how are you? So let's start with the first question which was asked. So पहला question पूछा गया था बेटा आपसे, which of the following statement regarding elimination characteristics of hit and run drugs are incorrect? Agreed? So first let me tell you what is hit and run drug. बेटा hit and run drug वो drugs होते हैं जो अपने organ पे irreversibly attach हो जाते हैं. Agreed? सो इरिवर्सिबल इनहिबिटर आर ऑल्सो नोन एज सुसाइड इनहिबिटर. ये ऑर्गन परमानेंटली अब काम नहीं कर पाएगा. सो रिमेंबर, अगर हम ये ड्रग को स्टॉप भी कर दे, इफ वी स्टॉप दिस ड्रग दे कंटिन्यू टू प्रोड्यूस एक्शन इन दैट ऑर्गन. सो कैन वी से दीज ड्रग्स दे कंटिन्यू टू प्रोड्यूस एक्शन इवन आफ्टर स्टॉपिंग देम. सो दे हैव लॉन्ग हाफ लाइफ. तो इनकी लॉन्ग हाफ लाइफ होती है एंड दे आर कंप्लीटली एलिमिनेटेड. मतलब यू विल नॉट फाइंड इन ब्लड. ये ड्रग ब्लड में नहीं मिलेंगे बट दे आर ऑन ऑर्गन एंड दे कंटिन्यू टू प्रोड्यूस एक्शन. सो एग्जांपल्स ऑफ हिट एंड रन ड्रग इज मुगरा. तो फर्स्ट इज माउ इनहिबिटर, organophosphates. Organophosphate they inhibit choline esterase enzyme irreversibly. Omeprazole and all proton pump inhibitor they inhibit proton pump irreversibly. Guanethidine, reserpine, and a very important drug aspirin. You know aspirin inhibit COX enzyme. In which fashion? Irreversible fashion. तो अगर आप एस्पिरिन बंद भी कर देते हो तो एक्शन आता रहता है. So let's keep this thing in mind. Let's talk about hit and run drug. So these drugs are eliminated quickly and have short half-life. Now this is a false statement. They have a long half-life. These drugs they produce prolonged effect even after they are eliminated from the body. This is a true statement. These drug require continuous administration. नहीं सर, इनको एक ही बार दे दो काम हो जाएगा. Omeprazole, reserpine are hit and run drug. True. Regular blood samples are needed to monitor plasma concentration. False. Remember, ये drug तो blood में होंगे ही नहीं. So which statement is true? Second and third. Second and fourth. Okay. Second and four are true. Now the question is asking which is a false statement. 1, 3 and 5. They are the false statement. So option A is the correct answer. Okay. Option A is the correct answer. So now a 25-year-old patient presented with agitation, confusion, hyperthermia है और mydriasis है and urine confirms amphetamine use. What is the most appropriate management strategy? So tell me, amphetamine remember is a basic drug. In amphetamine poisoning, the antidote is ammonium chloride because ammonium turns the pH of urine acidic and amphetamines are excreted out in urine. Okay, so the answer out here is ammonium chloride. Next question, which of the following statement is correct regarding drug absorption and excretion? Highly polar का मतलब होता है बेटा water soluble drug. They are absorbed easily. Now remember, सिर्फ एक lipid soluble drug ही absorb हो सकता है. False statement. Non-polar drugs are lipid soluble. So non-polar drugs are readily absorbable. True. Maximum unionization, that means lipid solubility occurs in small intestine. False. Remember, acidic drugs are becomes lipid soluble or non-ionized in acidic media. In small intestine the pH is basic. तो अगर यहाँ पे stomach होता then it would have been a correct answer because stomach में pH acidic होता है. Non-ionized form of the drug are less likely to be absorbed than ionized form. False. Non-ionized ज़्यादा absorb होते हैं. So the true answer is B. The answer of this question is B. A drug Z is given as an intravenous bolus and follows first order elimination. The plasma concentration of the drug decreases by 50% every 4 hours. मतलब 50% 4 hours में कम हो रहा है. So the half life of a drug is 4 hours. If the initial plasma concentration is 4 milligram after the dose of 80 milligram, what is the clearance of a drug? So we discussed it yesterday also that half-life of a drug is something around 0.7 volume of distribution upon clearance. Now remember, volume of distribution का formula होता है dose given IV divided by plasma concentration measured. तो इसमें हमने क्या dose दिया बेटा? In this we have given 80 milligram of the dose and what is the plasma concentration? 4 milligram per liter. So the volume of distribution is coming out to be 20 liter. कितना आ गया volume of distribution? 20 liter. Now put this volume of distribution in this formula, put this half life in this formula, calculate clearance. Can we say clearance हो जाएगा 4 is equal to 0.7 into 20 upon CL. अगर हम इसे कैलकुलेट करेंगे सो इट विल कम आउट टू बी 3.5. आंसर क्या आएगा बेटा? 3.5 liters per hour. Next question, when comparing two drugs for the same indication, a clinician prefers a drug with higher therapeutic index. Therapeutic index क्या होता है? Safety margin of a drug. The range between ED50 है ना, therapeutic index क्या होता था? Toxic dose in 50% of people divided by effective dose in 50% of people. इस range को हम बोलते हैं therapeutic index. So therapeutic index tells you about the safety of a drug. Next question. So this is how we have discussed therapeutic index. Okay. A certain receptor exhibit constitutive or basal activity even in the absence of ligand. A drug bind to this receptor and reduce this basal activity below the normal level. Which of the following best describe this drug pharmacological action? Now beta, let me tell you, suppose this is the basal activity. Let's say heart जो है 70 beats per minute पे beat कर रहा है. Even if you don't give any drug. If I give a drug which will produce 100% of the effect, इसे हम बोलेंगे full agonist. Full का मतलब जो maximum effect produce करेगा. Let's say maximum heart rate है 200 beats per minute, यहाँ चला गया. बट अगर एक ड्रग लेस देन 100% इफेक्ट शो करेगा, इसे हम बोलेंगे पार्शियल एगोनिस्ट. इसे हम बोलेंगे पार्शियल एगोनिस्ट. लेट्स से हार्ट बीट 150 बीट्स पर मिनट तक गई. नाउ अगर हम एक ड्रग दें एंड द ड्रग प्रोड्यूस नो चेंज, इफ देयर इज नो चेंज इन बेसल एक्टिविटी, हार्ट रेट 70 का 70 पे ही रहेगा, then it is known as antagonist. Then it is known as antagonist. Antagonist neutral molecule होते हैं, blockers होते हैं. They will not produce any change in basal activity. And if the heart rate reduces, let's say heart rate 30 beats per minute पे चला गया, कम हो गया, नेगेटिव हो गया, तो नेगेटिव के लिए we will use a word inverse. नेगेटिव के लिए क्या वर्ड यूज करेंगे? inverse. So here the answer is, see the question again. तो यहां पे क्या हो रहा है? reduce the basal activity. अगर reduce the basal activity है तो आंसर क्या होगा? inverse agonist. Okay, reduce मतलब कम हो जाना. So now let's talk about calculate the therapeutic index of this sedative drug और dose response curve दिया है. We know therapeutic index is TD50 upon ED50. What is the TD50 out here? TD50 is given as 200. And what is ED50? ED50 is given as 100. So the answer came out to be 2. So the answer is 2 out here. ठीक है. Next question, which of the following antagonist acts on different receptors? अलग रिसेप्टर पे काम करेगा एंड ऑपोजिट इफेक्ट आएगा. दिस इज नोन एज फिजियोलॉजिकल एंटागनिस्ट. दिस इज नोन एज फिजियोलॉजिकल एंटागनिस्ट. रिमेंबर हाउ इट विल वर्क. सपोज दिस इज एन एगोनिस्ट. एगोनिस्ट अपने रिसेप्टर पे काम कर रहा है और कुछ इफेक्ट प्रोड्यूस हो रहा है. हाउ फिजियोलॉजिकल एंटागनिस्ट विल वर्क? फिजियोलॉजिकल एंटागनिस्ट दे विल बाइंड टू डिफरेंट रिसेप्टर्स and they will produce exactly opposite effect. They will produce opposite effect to that of agonist. ठीक है. Now what is competitive and non-competitive antagonist? Competitive and non-competitive antagonists, they will block the receptor. ये क्या करेंगे? Block कर देंगे. That is why first two drugs they are known as blocker. They will block the receptor of agonist. What is inverse agonist? Inverse agonist is a type of drug that will act on same receptor and produce opposite effect. अगर same receptor से opposite effect आएगा तब हम बोलेंगे inverse agonist. Different receptor से opposite effect आएगा then we will call it as physiological antagonist. Okay. Now let's talk about a clinical trial of 4 new drugs were conducted and the following graph were obtained. So आप देख रहे हो इसमें efficacy और potency है. So remember one trick, one mnemonic, help. एक mnemonic याद करना है, help. H का मतलब हाइट. इन द ग्राफ अगर हाइट ज्यादा होगी द ड्रग विल बी मोर एफिकेशियस. ड्रग सबसे ज्यादा एफिकेशियस होगा. तो H एंड E मींस हाइट मतलब एफिकेसी. L का मतलब इफ द ग्राफ इज लेफ्ट साइडेड द ड्रग विल रिक्वायर लेसर डोज. लेसर डोज मींस द ड्रग विल बी मोर पोटेंट. सो हाइट, एफिकेसी, लेफ्ट साइडेड, पोटेंसी. सो कैन वी सी इन दिस ग्राफ सबसे ज्यादा हाइट किसकी है और सबसे ज्यादा लेफ्ट साइडेड भी कौन सा है? ए. सो ए इज द मोस्ट लेफ्ट साइडेड और इसकी हाइट भी सबसे ज्यादा है. सो कीपिंग दिस थिंग इन माइंड, अ ड्रग ए हैज हाईएस्ट एफिकेसी एंड हाईएस्ट पोटेंसी. द आंसर इज ट्रू. A drug A has highest efficacy but lowest potency, false. ड्रग डी पे देखते हैं बेटा एक बार, डी जो है ये सबसे राइट पे है तो ये लीस्ट पोटेंट हो गया और इसकी हाइट भी सबसे कम है, इट इज द लीस्ट एफिकेशियस ड्रग ऑल्सो, एग्री. सो डी हैज द हाइएस्ट एफिकेसी एंड हाइएस्ट पोटेंसी, सो इट इज अ फॉल्स स्टेटमेंट. ड्रग बी is more potent than C. अगर हम देखें the B is more left sided as compared to C. So yes, the drug is B is more potent than C. So option A and D are absolutely correct. So go with the correct answer A. Go with the correct answer A. Okay. Next question. A pharmaceutical company announces a new hypertensive drug was successfully demonstrated efficacy and safety insufficient of market approval after a comparative study. तो बताओ बेटा, टेल मी, यहां पे एफिकेसी हमें पता लग गई है एंड एफिकेसी हम कौन से ट्रायल में कंफर्म करते हैं, दैट इज फेज 3 ट्रायल. और फेज 3 ट्रायल के बाद द ड्रग कम्स इनटू मार्केट. आफ्टर फेज 3 द ड्रग कम्स इनटू मार्केट. ठीक है. फेज 1 ट्रायल इज डन टू आइडेंटिफाई सेफ्टी. इसमें हम क्या देखते हैं, सेफ्टी या फिर मैक्सिमम टॉलरेबल डोज. ओके. सो फेज 3 इज द करेक्ट आंसर. A diabetic patient on regular insulin accidentally injects himself with higher dose. He experiences symptoms of hypoglycemia. Which ADR can be seen? Remember, type A ADR, they are seen in high dose or toxic dose. Toxic dose मतलब high dose. So let's classify all ADRs. Adverse drug reaction. A का मतलब होता है augmented. Augmented का मतलब high dose पे जो होता है. It is also known as toxicity. सो द क्लासिकल एग्जाम्पल इज ज्यादा इंसुलिन लगाओगे तो हाइपोग्लाइसीमिया हो जाएगा. सो इट इज टाइप ए एडीआर. सो हाइपोग्लाइसीमिया टू इंसुलिन इज टाइप ए एडीआर. इसके अलावा दूसरे टाइप का एडीआर होता है टाइप बी. बी मीन्स बिजार. बिजार मीन्स कंफ्यूजन. सो ये साइड इफेक्ट किसी भी डोज पे हो सकते हैं. दे कैन अकर एट एनी डोज. टाइप ए अकर ओनली इन हाई डोज. द क्लासिकल एग्जाम्पल इज एलर्जिक रिएक्शंस. सो डोंट यू थिंक एलर्जिक रिएक्शन किसी भी डोज पे हो सकते हैं. The other types of ADR is C. C means continuous use से होते हैं. Like peptic ulcer, अगर आप एस्पिरिन कंटिन्यूसली खाओगे आफ्टर मेनी मंथ्स और ईयर, पेप्टिक अल्सर हो जाएंगे. सो ड्यू टू कंटिन्यूस यूज ऑफ अ ड्रग. डिलेड ऑनसेट मतलब ड्रग आज दिया, ADR केम आफ्टर मेनी मंथ्स. लेट्स से टेरेटोजेनिक इफेक्ट. You gave a drug in first trimester of pregnancy. Fetal malformation occurred after 9 months. एंड ऑफ ट्रीटमेंट. एंड ऑफ ट्रीटमेंट मीन्स सडन स्टॉपेज. अगर हम ड्रग को सडनली स्टॉप कर दे तो एडीआर होता है. क्लासिकल एग्जांपल इज विड्रॉवल रिएक्शन. एंड फेलियर ऑफ इफेक्ट. ड्रग ने अपना काम ही नहीं किया. सो कैन वी से ड्रग से रेजिस्टेंस आ गया है. सो रेजिस्टेंस टू अ ड्रग इज नोन एज एफ. फेलियर ऑफ इफेक्ट लाइक एंटीमाइक्रोबियल रेजिस्टेंस. सो हियर द आंसर वाज टाइप ए एडीआर. नेक्स्ट क्वेश्चन. विच ऑफ द फॉलोइंग इज ट्रू अबाउट काउंटरफीट ड्रग. काउंटरफीट का मतलब होता है नकली दवाई, और यू कैन राइट इट एज इंटेंशन टू चीट. आपने अपने कंज्यूमर को चीट किया या हार्म किया, तो नकली दवाइयों को, इलीगल दवाइयों को हम बोलते हैं काउंटरफीट ड्रग. सो काउंटरफीट ड्रग में कंटेन इनकरेक्ट इंग्रेडिएंट. बिल्कुल सही बात है, इनकरेक्ट हो सकते हैं. These drugs often have same effect. नहीं यार, सेम इफेक्ट तो नहीं आएगा इनका. इनका तो इफेक्ट कम आना चाहिए. काउंटरफीट आर यूजुअली सब्जेक्ट टू रिगरस क्वालिटी कंट्रोल. सर अगर क्वालिटी कंट्रोल करते तो काउंटरफीट होता ही नहीं, तब तो मिलावट हो ही नहीं सकती थी. फॉल्स. दे कैन लीड टू ट्रीटमेंट फेलियर. यस. कॉन्ट्रीब्यूट टू ड्रग रेजिस्टेंस फेलियर. इनका इफेक्ट तो आएगा नहीं. ट्रू स्टेटमेंट. काउंटरफीट में बी लेबल्ड विद फेक पैकेजिंग एंड रिजेंबल जेन्युइन प्रोडक्ट. ये भी ट्रू है स्टेटमेंट. तो लोग नकली दवाई ऐसे ही बनाते हैं. सो 1, 4 and 5. ओके. सो द आंसर आउट हियर इज 1, 4 and 5. Okay. Now let's talk about a 68-year-old woman with a long history of diabetes presented to complaints of frequent urinary tract infection, difficulty in emptying bladder. She reports feeling like she needs to urinate urgently. But when she tries to go, very little urine comes outside. After ruling out urinary tract obstruction, which medication you will address her symptom? So can we say this female is having the difficulty in passing out urine? So the drug of choice to contract bladder, the drug which is given to contract bladder is bethanicol. Remember, bethanicol acts on M3 receptors, and M3 receptor is present on bladder. It will contract bladder and it will relieve this It will cause urine to be passed out. Where pilocarpine is given as an eye drops. It is given to produce meiosis, and meiotic drugs are given in the treatment of glaucoma. Atropine and atropine, remember, is an anticholinergic drug. It will not contract bladder. Remember, it will rather relax bladder, and it will further increase urinary retention. So it will further lead to urinary retention. Don't give atropine. Now, hydrophonium also increase acetylcholine, but it is a very short acting drug. It is only given in diagnosis of myasthenia gravis. It is only given in diagnosis of myasthenia gravis. And you know a test in myasthenia gravis known as tensilon test. So tensilon is another name of hydrophonium. Now let's talk about a 45-year-old male presented with chronic cough, shortness of breath. Upon further inquiry, it was revealed that he has been a smoker for 20 years. Doctor discusses the risk of smoking and recommend nicotine cessation therapy. Which of the following drug is a first-line drug? Anyone, what is the first-line drug? Anyone, what is the first-line drug for smoking, de-addiction, nicotine de-addiction? Yes, the answer out here is bupropion. So answer out here is bupropion. So remember three drugs which are first-line drug for smoking cessation: nicotine, varenicline, and bupropion. The drug which is a second-line drug is clonidine. And among them, varenicline is the most effective drug. It is the most effective drug we have for smoking cessation. Okay. Next question, a 30-year-old female with no significant medical history presented with clinic with complaints of intermittent shortness of breath, wheezing. Okay. So wheezing means asthma. Okay. Over past few months, her physical examination spirometry is unremarkable. The physician prescribed to do a methacholine challenge test. So remember, when you give methacholine, it provokes asthma. It provokes asthma. And it is used as a diagnostic test. It is used as a diagnostic test to provoke asthma. So why we give methacholine? To identify air hyperactivity consistent with asthma. So C is the correct answer. Yes. Next question, a 6-year-old girl brought to emergency department by her parent. She was unresponsive. They report that her younger sister sprayed a patient with a bottle of pesticides. Remember, pesticides, they generally contain organophosphate and carbamate. Organophosphate and carbamate, which increase acetylcholine level, and all the secretions in the body increases like salivation, lethargy. And which of the following medication as a first line drug? So can you tell me the antidote? Yes, the antidote is atropine. So overall drug of choice is atropine, but remember, in organophosphate poisoning, you can add a drug. In OP poisoning, organophosphate poisoning, pralidoxime, but we will go with atropine because atropine is a life-saving drug. Okay, to save the life of a person, the first drug we should always give is atropine. Next, a 67-year-old male patient with a known history of primary open-angle glaucoma presented to clinic for routine eye examination. He reports no new symptom. Intraocular pressure is well controlled. Which of the following medication is preferred in patient for dilating pupil? Dilating pupil means mydriasis. And can you tell me which drug you will give in to dilate pupil to produce mydriasis? Remember, old age. In old age, to produce mydriasis. Okay. Old age mydriatic. Okay. Now remember, fundoscopy in children. Fundoscopy in children, we prefer to give atropine. But if a question comes, fundoscopy in old age, we prefer to give phenylephrine. We prefer to give phenylephrine. Remember, atropine is an anticholinergic drug. It can provoke asthma and many other things. And atropine-like drug, remember, they are mydriatic drug. So this atropine, homatropine, cyclopentolate, they are contraindicated in mydriatic. They are mydriatic. They are contraindicated in a patient of glaucoma, and glaucoma can occur in old age. That is why we don't prefer. So the answer out here is phenylephrine. Phenylephrine stimulate alpha-1 receptor, and it can lead to mydriasis. So in old age, we prefer to give phenylephrine. Now, a 65-year-old woman with schizophrenia treated with antipsychotic drug haloperidol, and there is tremors and stiffness. Remember, haloperidol or antipsychotic drug, they block dopamine receptor. Which receptor they block? They block dopamine receptor, antipsychotic drug. Now, which symptom do you think are coming? Stiffness, bradykinesia, rigidity, resting tremor. So this woman has developed Parkinson disease. Can we say it is drug-induced Parkinsonism? And in the treatment of drug-induced Parkinsonism, we give anticholinergic drug. We give anticholinergic drugs. Okay. Now, which of the following she has been prescribed anticholinergic drug? So, which of the following is not a typical anticholinergic drug but still used for this purpose? What is the answer? Remember, the first three drugs are only and only anticholinergic drug. But remember, promethazine, it is an antihistaminic drug. It is an antihistaminic drug, and antihistaminic drug, they have anticholinergic action also. So remember, promethazine is not an anticholinergic, but still given for the treatment of drug-induced Parkinsonism, because antihistaminic drug, they have anticholinergic action. So here the answer is D. Next question, a 30-year-old woman presented with nausea, dizziness and vomiting after traveling by boat. So boat, remember boat, and she's traveling. Now, she reports that, can we say nausea and vomiting in boat? This is known as seasickness. This is known as seasickness. Now, she reports symptoms occur whenever she is in motion, particularly sailing or driving. Driving means she is also suffering from motion sickness. She is also suffering from motion sickness. The patient states that her symptoms significantly interfere. Now, question is, now she has been prescribed a patch, transdermal patch. What is the drug of choice? Remember, hyoscine is available as a transdermal patch, while cyclizine and meclizine, they are given orally for the treatment of seasickness and motion sickness. So which drug is available as a patch? Hyoscine. Any other drug which is available as a patch? Yes, the another drug which is available as a patch as diphenhydramine. So all these drugs are given for motion sickness and seasickness. What about acetazolamide? Acetazolamide is given for another sickness known as mountain sickness, in which the patient has respiratory depression. There is no nausea and vomiting in mountain sickness. There is respiratory depression. So here the answer is A. Option is A. A 34-year-old male presented with symptoms of acute onset blurred vision, dry mouth, tachycardia, urinary retention. Medical history unremarkable, and the pupils are dilated and unreactive to light. Which of the following is the cause? Can you tell me which poisoning? You will have dry eyes, dry mouth, all the secretions are reduced. Can you tell me which poisoning we are talking about? Yes, in atropine poisoning, all the secretions of the bodies are reduced. Pupils become dilated and unreactive to light. Unreactive to light means loss of accommodation. So the answer of this question was atropine poisoning. So the patient is suffering from atropine poisoning. Okay. In cocaine poisoning, remember, there will be increase in salivation. In opioid overdose, the main symptom will be respiratory depression, and the patient will have bradycardia. Here the patient is having tachycardia. And same thing will be happen in benzodiazepine overdose. Here the patient is having tachycardia. Okay. So next question, a patient went into hypotension, spinal anesthesia was given, a drug acting on alpha and beta receptor was given to stabilize. Which of the following drug is given? Remember, phenylephrine only acts on alpha 1 receptor. Agreed? Clonidine acts on alpha 2 receptors. Epinephrine acts on alpha and beta receptor. Ephedrine acts on alpha and beta receptor. But which drug is given for hypotension in spinal anesthesia? The answer is ephedrine. Epinephrine is given rather for anaphylactic shock. So here the answer is ephedrine, given to increase blood pressure if there is a hypotension with spinal anesthesia. Okay. So answer is B. Next question, a 24-year-old female presented with fever, hypotension, rashes from tampon. She exhibits signs of confusion and tachycardia. So which shock she is suffering from? She is suffering from septic shock. She is suffering from septic shock. And the drug of choice for septic shock treatment is norepinephrine. Now remember, in any shock, this is a question of surgery also. Can we say the blood pressure will increase and we monitor whether the drug is producing effect or not by checking mean arterial pressure? What we will check? We will check mean arterial pressure, because mean arterial pressure will tell you the organ perfusion, that how much blood is finally reaching to an organ which has been reduced in cases of shock. So in any shock, monitor mean arterial pressure. Okay. Now next question, a 7-year-old child brought to clinician due to difficulties in concentrating, impulsivity, excessive fidgeting. So he has been diagnosed with ADHD. Which of the following medication would not be appropriate for managing the patient's symptom? Remember, the overall drug of choice for ADHD is methylphenidate, because it improves attention span or concentration power. So attention deficit is cured. Atomoxetine and clonidine, they are preferred in patient of ADHD with Tourette syndrome. They are given in Tourette syndrome if ADHD is associated with Tourette syndrome. So which drug is not given? Lorazepam is not given in cases of ADHD. So the answer of this question is D. Lorazepam has no role. Benzodiazepines are not used. Next question, a 25-year-old child brought for routine eye examination. Which of the following is most appropriate for pupillary dilation or fundoscopy? So beta, I have told you the drug of choice for fundoscopy in small child is atropine. It is a very strong drug. In a strong children, to dilate pupil, we need a very strong drug. So atropine is the drug of choice for fundoscopy in children. It is used as a 1% ointment for fundoscopy in child. Fundoscopy in child. Which drug you will give? Atropine. Next, you are an intern assisting in operation theater. During surgery, the patient suddenly goes into shock, refractory hypotension. Surgeon asks you to prepare dopamine. Which of the following would be most appropriate? Remember, in shock, we give very high dose of dopamine. Which dose of dopamine we use? High dose. So the highest dose out here is 10 to 50. So the answer out here is C. Let me tell you about dopamine, an important drug. Remember, dopamine has 3 doses. Low dose, medium dose, and high dose of dopamine. In low dose, it acts on D1 receptor, which produce vasodilation in kidney. And in low dose, dopamine is given in the treatment of ARF, acute renal failure, and the side effect comes out to be hypotension because of vasodilation. In medium dose, it will start acting on beta 1 receptor. Beta 1 receptor is present on heart and it stimulates heart. It has inotropic effect. It is given in the treatment of acute heart failure. Side effect logical will be arrhythmias on heart. But in very high dose, more than 10, dopamine stimulate alpha 1 receptor present on blood vessel. It produces vasoconstriction and increase blood pressure. Remember, in the treatment of shock, we use high dose of dopamine. So just see which dose is written out here. More than 10. More than 10 will be the correct answer. Next question. Which of the following is the most appropriate drug of... So remember, in the treatment of septic shock, the drug of choice is norepinephrine. Norepinephrine is the drug of choice. Malignant hypertension. To treat hypertension, you can give phenoldopam. Oligouria word is coming, dopamine. Wherever oligouria word will come, dopamine. And cardiac arrest we give epinephrine. So can we say 1 का 4, 2 का 3? ठीक है, 1 का 4, 2 का 3. The answer out here is, I think, A. 3 का 2. So A is the correct answer. And 4 का 1. Okay. So this is the correct answer. Next question, a patient is diagnosed with pheochromocytoma. So which drug inhibit tyrosine hydroxylase? The drug which inhibit tyrosine word is coming in, mityrosine. So why we give mityrosine in pheochromocytoma? To reduce catecholamine synthesis to reduce the production of epinephrine, norepinephrine. Remember, phenoxybenzamine is also given in pheochromocytoma, and it is given to reduce blood pressure. Reduce blood pressure means it is given to control hypertension in pheochromocytoma. While metyrosine, remember, it is given to reduce catecholamine production. So it is the overall drug of choice for pheochromocytoma. Agreed? Clonidine is sometimes given for diagnosis of pheochromocytoma. Agreed? Clonidine is sometimes given for diagnosis of pheochromocytoma. Next question. Which of the following drug inhibits VMAT? VMAT stands for vesicular monoamine transporter. Remember, when there is a dopamine, dopamine enters into vesicles, and then this dopamine is released. Then this dopamine is released out of a nerve. Nerve releases. Now, if a dopamine has to release, it must enter into vesicle. For the entry of dopamine into vesicle, there is a transporter known as VMAT, vesicular monoamine transporter, and the drug which inhibit entry of dopamine into vesicle will inhibit the release of dopamine. So these drugs, they inhibit dopamine release. These drugs, they inhibit dopamine release. And these drugs, they will end with the word benazine. These drugs, they end with the word benazine. Can you tell me any famous drug you know? Like tetrabenazine, valbenazine. So these are the drugs which will inhibit dopamine release. And remember, in a disease known as Huntington's chorea, there is excessive dopamine production. Excessive dopamine leads to dancing-like movement. Dancing-like movement is known as chorea. Hence, the drug of choice for the treatment of Huntington's chorea is tetrabenazine and valbenazine. They inhibit the release of dopamine. Okay, they are absolutely contraindicated in Parkinson disease. And one cause of Parkinson disease is Lewy body dementia. Remember, here already the dopamine is less. So we never give this drug in Parkinson disease. They are rather given in opposite disease, that is Huntington's chorea. Next question. A 65-year-old man presented with 6-month history of resting tremor, bradykinesia, rigidity, walking. So patient is suffering from Parkinson's disease. And this Parkinson is occurring in an old age person. Which of the following medication is least effective? So which drug is not given in Parkinson disease? Remember, we don't give beta blocker in Parkinson disease. We give levodopa, pramipexole, stimulate dopamine receptor, amantadine, antiviral drug. It is also given in Parkinson disease. Propranolol is rather given in different type of tremors known as essential tremors. In essential tremors, we give propranolol. Propranolol has no role in Parkinson disease. Next question, a 70-year-old female with stage 3 chronic kidney disease presented with hypertension, history of MI, considering her renal function and cardiovascular history, which beta blocker will be best management? Remember, after MI, remember, okay, after MI, we need a cardioprotective drug. And patient is having kidney disease. Remember, there are 3 beta blockers which are contraindicated in CKD. So remember, ANS. Which beta blocker are contraindicated in chronic kidney disease? Atenolol and acebutolol, nadolol and sotalol. So these drugs you will not give. Plus cardioprotective drug we have is metoprolol and few other beta blocker which I will be going to tell you. So the best answer out here is metoprolol. The answer out here is metoprolol. Next question, which of the following calcium channel blocker causes heart blockage? Remember, on heart, only 2 calcium channel blockers they work, verapamil and diltiazem. These calcium channel blocker are known as calcium channel blocker non-DHP type. We have one more class of calcium channel blocker, DHP type. DHP type, they will end with our dipene, they will act on blood vessel and they will produce vasodilation. Okay, so only 2 beta blocker act on heart, verapamil and diltiazem, and because of this reason, they will lead to bradycardia. They produce bradycardia. And because they produce bradycardia, they are never combined with beta blocker, because beta blocker also produce bradycardia. With beta blocker, we never give verapamil and diltiazem. But which calcium channel blocker can be given with beta blocker? Any calcium channel blocker ending with the word dipene, they are safe to be given with beta blocker. So the answer out here is diltiazem. Answer out here is diltiazem. Next question. A 38-year-old female who was on propranolol developed bradycardia. Beta blocker can cause bradycardia and propranolol is a beta blocker. And she was admitted to cardiac ICU. On discharge, the medication was changed from propranolol to another beta blocker which has intrinsic sympathomimetic activity. Remember, intrinsic sympathomimetic means these drugs are not complete blocker. They have little bit of sympathetic activity. So these beta blocker are also known as partial agonists. So these beta blocker are also known as partial agonists. The great advantage of these beta blocker is they have no risk of causing bradycardia because they are little bit agonist. So they have no risk of causing bradycardia. So which beta blocker have partial agonist activity? Remember two drug P and A. P for pindolol and A for acebutolol. So these two beta blocker have no risk of causing bradycardia. So answer out here is pindolol. Answer out here is pindolol. Next question. A 58-year-old male with benign prostate hypertrophy BPH was recently given prazosin. Which side effect should be informed about starting this medication? Remember, prazosin is an alpha-1 blocker. Agreed? And alpha-1 receptor is present in three areas. 1b. It is present in internal urethric sphincter. So internal urethric sphincter is a sphincter in the bladder. So when you give this alpha-1 blocker, this sphincter, internal urethric sphincter in bladder will open. Below this sphincter, we have opening of seminal vesicles. So when seminal vesicles will open, it will lead to retrograde ejaculation. It will lead to retrograde ejaculation. So this side effect is seen. Second, they are present on iris. Normally, alpha-1 receptor causes mydriasis. Blockage of alpha-1 receptor will lead to iris paralysis. And this iris will be paralyzed and will be floating in ice, which is known as floppy iris syndrome. And lastly, alpha-1 receptor is present on blood vessel. Normally, alpha-1 causes vasoconstriction. If you block alpha-1 receptor, it will lead to vasodilation and the blood pressure will fall. So the third side effect will be postural hypotension. Now remember one point, that any drug which produces vasodilation has a side effect of causing reflex tachycardia. Any drug which produces vasodilation causes reflex tachycardia, not bradycardia. So 1, 2 and 3 are true statement. So go with the answer D. Go with the answer D. Next question. A 52-year-old male with severe episodic hypertension, headache, palpitation, elevated urine metanephrine is diagnosed with pheochromocytoma. Now, drug of choice to manage hypertension in pheochromocytoma. Recall, for hypertension in pheochromocytoma, we give a drug with Phe. Which drug? Phenoxybenzamin is given to manage hypertension in pheochromocytoma. We discussed it already. Next question, what is the preferred medication for managing hypertensive crisis with sudden withdrawal of clonidine? Remember, when you suddenly withdraw clonidine, clonidine normally inhibit release of norepinephrine. So there is sudden increase in release of norepinephrine. So it causes sudden release of norepinephrine. Norepinephrine will act on blood vessel. On blood vessel, we have alpha receptor and it will lead to vasoconstriction and BP will increase when you suddenly withdraw clonidine. And this leads to hypertensive crisis which is happening out here. So can you tell me which drug we should give? To sudden withdrawal of clonidine, we must give a drug alpha blocker. We must give a drug alpha blocker, and among them, which drug is an alpha blocker? Yes, the drug which is an alpha blocker is phentolamine, is given to manage hypertensive crisis due to sudden withdrawal of clonidine. Next question. A 65-year-old man with chronic heart disease presented with nausea, vomiting, visual disturbance, yellow vision. Can you tell me which drug causes yellow vision? Yes, the drug which causes yellow vision is digoxin. And digoxin is given in a patient of chronic heart failure. It is given in the treatment. Now, this patient now developed ventricular tachycardia. So, can we say digoxin side effect is arrhythmia, ventricular tachycardia? And how to treat ventricular tachycardia? We know a very famous drug. So, treatment of digoxin-induced ventricular tachycardia is lignocaine. Lignocaine is given in the treatment of ventricular tachycardia. Another name of lignocaine is lidocaine. Lignocaine is also known as lidocaine. Okay. Remember, atropine is given for the treatment of bradycardia. Atropine is given in the treatment of bradycardia. Okay. Now let's talk about next question. A known asthmatic is diagnosed with chronic heart failure and asthma. Which of the following drug provides the most therapeutic benefit? So which drug provides the best benefit? Now remember, asthma is because of beta 2 blockage. Okay. And in asthma, we don't prefer to give non-selective beta blocker. We don't prefer to give non-selective beta blocker because non-selective beta blocker, they block both beta 1 and beta 2. In a patient of asthma, we prefer to give cardioselective beta blocker. We prefer to give cardioselective beta blocker, which mainly block beta 1 and less of beta 2. Less of beta 2. Okay? Less of beta 2. And the most cardioselective beta blocker is nebivolol, followed by bisoprolol. While carvedilol and sotalol are non-selective beta blocker. So the answer out here is nebivolol. Answer out here is nebivolol. Okay. Answer out here is nebivolol. Next question, a 58-year-old female with hypertension, heart failure, given ACE inhibitor. ACE inhibitor, they end with the word pril. For blood pressure control, most significant interaction. Remember, any drug which ends with the word pril, ACE inhibitor, is a RAS inhibitor. And normally RAS causes absorption of sodium, loss of potassium. So when you give RAS inhibitor, sodium will be lost in urine, but potassium will be spared. So the side effect of ACE inhibitor is hyperkalemia. They can increase potassium level in the body. They should be avoided with which diuretic? They should be avoided with potassium sparing diuretic, because potassium sparing diuretic also cause hyperkalemia, and excessive hyperkalemia will lead to cardiac arrhythmias. So we avoid giving ACE inhibitor with potassium sparing diuretic. Loop diuretic can be given because loop diuretic, they can cause hypokalemia. So it will balance out each other. So avoid with potassium sparing diuretic. Next question, a 55-year-old man with a history of alcoholic cirrhosis. Now the patient is having abdominal distension, decreased urine output, tense. Decreased urine output is there, beta. Decreased urine output means the patient is also going into ARF. So a patient of chronic liver disease going into acute renal failure. This condition is known as hepatorenal syndrome. You can even see elevated creatinine level. So patient of liver disease going into renal failure because of low blood supply, this is known as hepatorenal syndrome, and the drug of choice for the treatment of hepatic or renal syndrome is terlipressin. Because terlipressin increases blood pressure, it restores the blood supply to the kidney. So it was a recent question asked. So hepatorenal syndrome, terlipressin. And terlipressin is also given for bleeding esophageal varices. It is also given for bleeding esophageal varices, which is seen in a patient of chronic liver disease. So hepatorenal syndrome, bleeding esophageal varices, both occurs in liver disease. In liver disease, we give terlipressin. Next question, a 50-year-old patient with a history of cardiac arrhythmia presented with allergic rhinitis. The physician was confused between terfenadine and fexofenadine. Remember, terfenadine got banned. Because it was causing QT prolongation and it was increasing the risk of an arrhythmia known as torsades de pointes. That is why we made fexofenadine. Fexofenadine, no risk of arrhythmia. It comes with the brand name Allegra. So what is the better benefit of using fexofenadine over terfenadine? That fexofenadine, less risk of causing cardiotoxicity or cardiac arrhythmias. That is the correct answer, option number C. Next point, a 35-year-old woman with a history of experiencing frequent and severe migraine. A doctor recommends 5-HT2 blocker to prevent this attack. Which medication is given? So 5-HT is a receptor of serotonin. So which serotonin blocker is given for prevention of migraine? The answer is cyproheptadine. So cyproheptadine is given for prevention of migraine. It is an approved drug, and cyproheptadine is also the drug of choice. It is also the drug of choice to treat serotonin syndrome. It is also given for the treatment of serotonin syndrome. When the level of serotonin is very high, we give cyproheptadine to block serotonin receptors. Next question. A working professional persistently having osteoarthritis seeking NSAID non-steroidal anti-inflammatory drug that gives 24-hour relief once a daily dose. So which of the following is the overall longest NSAID? Longest NSAID. Longest NSAID is जो काम ही करता रहेगा, जो काम ही करता रहेगा, that will be longest acting drug like piroxicam, tinoxicam. So these are the longest acting NSAID. Now why they are long acting drug? Because they are excreted in bile, and when they are excreted in bile, they again get reabsorbed. They undergo entero from intestine, hepatic reabsorption from bile. So they keep on circulating in the blood. They become long acting drug. So the answer out here is piroxicam. What is the correct answer? Piroxicam. Okay. Next question. A 48-year-old woman with osteoarthritis started on NSAID, knee pain. Student discussed several statements. Which of the following is the mechanism of action of NSAIDs? Now remember, NSAIDs are the drugs which inhibit COX enzyme, cyclooxygenase enzyme. Now there are two varieties of COX enzyme. The first is COX-1 and second is COX-2. Remember, COX-2 is responsible for inflammation. COX-2 is responsible for inflammation. While COX-1, it is a constitutive enzyme. Constitutive means it is responsible for normal body function. If I say normal body function, like it protects stomach, it decreases HCl production, and it protects stomach. This is the normal function. Agreed? So if I'll ask you, if you want to control inflammation, which COX enzyme you should inhibit or block? You should only block COX-2, which becomes activated during inflammation. While COX-1 is a normal, very good COX-1 enzyme, which maintains normal body function. Agreed? So let's see. COX-1 is constitutively expressed in gastric mucosa. True statement. NSAIDs inhibit phospholipase. False. The drug which inhibit phospholipase is corticosteroids. Corticosteroids, they inhibit phospholipase A2. COX-1 is constitutively expressed and involved in various body function. False. Just a normal thing I want to tell you. In option A, it should be COX-1, not COX-2. So first statement is a false statement. B is also false. Third is a true statement. COX-1 is a constitutive expressed enzyme which is responsible for various physiological function. So C is the true statement. Now, lipooxygenase inhibition is the mechanism of action of NSAID. Now, this is a false statement. The drug which inhibit lipooxygenase enzyme, the drug name is Xileuton. Xileuton is given in asthma. So here the answer is option number C. C is the correct answer of this question. Next question, a 68-year-old diabetic, chronic kidney disease, diabetic foot due to MRSA, and you started giving streptogramin antibiotic. Remember, streptogramin antibiotic is a mixture of two drugs, quinpristine, dalfopristin combination. It is a quinpristine and dalfopristin combination. It is effective against MRSA, VRSA, vancomycin resistant staph aureus. MRSA means methicillin resistant staph aureus. And these streptogramin, remember, these streptogramins, they are only given in resistant case. So they are reserved drugs. They are reserved drugs. They are not the first line drug. What is their mechanism of action? They inhibit protein synthesis. So the first statement is true. They inhibit protein synthesis by binding to 50S ribosome. This is a true statement. Second, they cover both gram-positive and negative. No, they only cover gram-positive bacteria like Staphylococcus, which is a gram-positive bacteria. It is a first-line therapy. No, it is a reserved drug. Their main side effect is nephrotoxicity. No, their main side effect is muscle pain, myalgia, and joint pain, arthralgia. This is their main side effect. So option A is the correct answer. Next question. A 30-year-old male recently treated for painless lesion on palms and sole, emergency department, myalgia, and the patient developed fever, chills, and myalgia. Now, why developed after taking benzathine penicillin? Benzathine penicillin, painless lesion, and now the patient is having other symptoms of tachycardia and hypotension. Now, what is the main cause? Now remember one point. When you give benzathine penicillin, especially in a patient of syphilis, it causes one hypersensitivity reaction. This hypersensitivity reaction is known as Zarek-Shurk-Seymour reaction. It is known as Zarek-Shurk-Seymour reaction. And because of this hypersensitivity, the patient is having fever, chills, myalgia, tachycardia, and hypotension. Now, if Zarek-Shurk-Seymour reaction develops, you should not stop penicillin, just add corticosteroids to overcome this problem. So continue this medication and start antipyretic like corticosteroids and NSAID. So this is the management of Zarek-Shurk-Seymour reaction. So the correct answer of this question was A. Okay. Next question. A 30-year-old female presented to clinic with sore throat, fever from past 3 days. Previous medical history includes breathing issues, rashes by unknown medication which was used to treat syphilis 1 year ago. A throat swab confirms streptococcal infection. What is the best treatment? Now remember, for streptococcal you can give penicillins. Remember, amoxicillin is also a penicillin. Penicillin V is also a penicillin. But the patient is having breathing issue, rashes. So the person is allergic to penicillin. And if a person is allergic to penicillin, you will not give amoxicillin and penicillin V. And remember, in cases of penicillin allergy, even cephalosporins are contraindicated. Because cephalosporins, they show cross allergy with any type of penicillin. So which drug is a cephalosporin? Ceftriaxone. So what is the drug of choice in a patient of penicillin allergy? Yes, the answer out here is erythromycin as a drug of choice. Next question. A 45-year-old male with pulmonary tuberculosis presented with acute swelling in his right big toe after 6 weeks of anti-tubercular therapy. The toe is tender, erythematous, warm to touch, uric acid level is increased. So yes, the patient is suffering from gouty arthritis. The patient is having gout. Which of the following drug is most likely responsible for this gout? Remember, there are two anti-tubercular drugs which can cause gout. Maximum risk of gout is by a drug pyrazinamide. Any other drug which can cause gout? Yes. Another drug which can cause gout in TB, two drugs, pyrazinamide and ethambutol. But remember, maximum risk is with always and always pyrazinamide. So the answer of this question was pyrazinamide. Next question. A 45-year-old male presented with complaints of intense itching at night, rashes developed over past few weeks. On examination, multiple small red papule, burrows are noted. Can you tell me which disease we are talking about? Burrows are there. If burrows are there, then it is scabies. And wife and children are also experiencing, scabies is highly contagious. It spreads among family members. What is the overall drug of choice for scabies? The overall drug of choice for scabies is permethrin 5% cream or 5% lotion. It is the overall drug of choice for scabies. Next question. Match the following drug with their appropriate mutation target in cancer. Now remember, Erlotinib. Erlotinib, it inhibits EGFR, epithelial growth factor receptor, and epithelial growth factor receptor is also known as HER1 receptor, human epidermal growth factor receptor. It is the most common mutation seen in non-small cell lung cancer. Okay. Now, in erlotinib resistant cases, why erlotinib resistant occurs? Because of mutation in this EGFR receptor. This mutation is known as T790 mutation, and it can also lead to lung cancer. Here we give osimertinib. Here we will give osimertinib. Okay. Here we will give osimertinib. Lapatinib. Lapatinib is given for trastuzumab resistant, not HER1, rather HER2 positive breast cancer. And Venditanib. Vendi means Vande Mataram. Mataram means it is given for M for medullary carcinoma of thyroid. It is given for medullary carcinoma of thyroid. Okay. So remember, 1 ka, for 1 it's B, for 2, okay. So the answer out here is A. Answer out here is D. Last question, which of the following is a clinical feature of milk alkali syndrome? Now, milk alkali syndrome occurs because of repetitive intake of calcium containing antacids. Calcium containing antacid. Remember, any antacid is a basic drug which is given to neutralize the acidity in the stomach. And if a person takes repetitive calcium containing antacid, what will happen in blood? Calcium will be absorbed and there will be hypercalcemia. Because they are basic molecule, the blood pH will also become basic. It will lead to metabolic alkalosis. And this excessive calcium, when excreted in urine, it will lead to formation of renal stones. So these are the 3 features of milk alkali syndrome. Okay. So can you tell me what is the correct answer? The correct answer is hypercalcemia, which is seen out here. So these are the 3 features of milk alkali syndrome. So I hope your test went well. So best wishes.